Hello, all, and welcome. The topic of this upcoming discussion is on workforce development in healthcare. In this first episode, we revamp a previous live talk and we'll hear about learning strategy in healthcare. We will hear from Susan Minaya, COO and Chief Learning Strategist from Minaya Learning Global Solutions, a training services company, as well as Andy Lawrence, Vice President of Enterprise Learning and Personal Development and Human Resources at SCL Health. I'd also like to mention they are boasting about 50 years of experience collectively as learning strategists. Stay tuned to learn more.
What are those signs that really signal, you know what, we really need a learning strategy here? What are some things that you have?
Well, it's a great question, Susan, and it is a passion topic for both of us. You know, I kind of look through the lens of taking a peek at what is the organizational performance, indicating. What's the current return on investment? You know, when I came into healthcare, I've worked in a number of different verticals, much like yourself. Everything from transportation to energy to financial services, telecom, and now healthcare. And healthcare obviously is just top of mind. Those are the two areas, operational performance and return on current investment, that the lens that I look through. I think we have to take cues from operations. Operations in healthcare, are the service lines, it's the care sites, it's the leaders, it's the associates, it's the front line. I think it's important that we stay very, very closely connected to core. And of course, everything in healthcare is about our patients. I look at, is the organization in a growth mode? Is it a defender? Is there competition in the market? Are we a disruptor? Are we innovating? And then turning the lens a little bit more toward training and development, you have to ask, what's the value of training? In healthcare, it's very closely aligned to the academic models, research and development, asking the team, what's the perception, or asking leaders really, what's the perception of the learning organization, or as we refer to it, the community of practice? And then what's the perception of the team themselves? So everything from engagement surveys to, what associates are saying, reputation, even who drives decisions in the organization. These are all factors that I think are important for any learning leader, whether you're new to a particular industry. There's that old adage of 1,000 questions and 500 answers. Everything comes back around again. And I think we're both living proof of that.
Definitely so. And, I think from a consultative lens, I guess I would add to that often when I'm working with clients, really for me, key indicators, and I know this was true for me when I was a learning leader in an organization, was really signs of just how we're doing from a performance perspective, like you talked about. And so it's like, do we find ourselves being order takers in the learning organization? We're just like, can't catch a breath, and we're just like, have this deluge of demand coming onto us. And it feels chaotic all the time, And I think really, kind of looking at what are we doing? Is the work that we're doing strategic work, or is it really that's helping the organization move forward? Or are we just like sitting there churning out training, and we have no idea whether we're making an impact or we're not, And so that's a really exhausting and frustrating place to be. And I think for me, what I see, some of the things are really being very understaffed. Are we really set up to be successful to support this organization and our mission, which I think is to be an enabler for workforce development, and also for the organization to achieve their goals through people. So for the people that are out there listening to us, I think, okay, so we found out that we definitely we think we need to do a learning strategy. We want to show up differently as a learning organization and be valued for as a strategic partner for the organization. And so, you don't just show up and say, "Here's my plan."
Right.
There's because it's number one, especially if you're not a really well-performing learning organization, or you're just sort of not regarded as strategic, it's sort of, you can be dismissed, right? Organizationally, even the best learning leaders, so it's like, I guess what I want to talk about and turn the conversation to is how might a learning professional gain street credibility? So if I'm a learning leader, how am I going to get that street cred with leaders in the organization to actually listen to me? What are some things that you've done or seen, right, to kind of get traction there?
Yeah, I've been giving this some thought, and I'm going to answer it through the lens of my own experience, because that's what I know. I've come into a lot of different organizations. I've moved different verticals. I think the number one thing is to connect with your customer. Talk their language. Don't talk HR or OD, speak, if you will. We all tease one another about HR math. It's talking their language. And I think what we're trying to get to is find out really quickly what's important to the business and the service lines that you support. And then you cannot get away from knowing your craft. You have to know it inside and out, methods, practice, what's contemporary, what's coming down the line, what's worked in the past, whether it's andragogy or pedagogy, really having that backbone and structure, and then tell your story and tell it early, tell it often, back it up with facts, figures, but hey, those facts and figures have to be meaningful to the business. Reduce time to train, increase representative or associate performance with no loss of fidelity. That's what gets the attention of the C-suite. That's what gets the attention of the service line. There's also that component, Susan, of, as chief architects, because let's face it, I think a lot of what learning and development is moving toward is that architecture. It seems to be a word that's coming into play. I know we're using it even in our job descriptions and our titling, education architect. I think there's also something that we have to balance, and that is we don't want to have to use terms like dragging people to the finish line, because that just takes way too much energy and it exhausts us, and oftentimes causes us to go right back to what's comfortable or what the organization wants. From a historical perspective, you said right at the top of our conversation, that order taker mindset. I boil it down to sometimes you have to be very strategic about realizing that in order to move people along the continuum of acceptance, they have to want it more than you want it for them. And so finding that, I think, only comes through collaboration and landing on that. One of the questions that I find most valuable, and I've asked it numerous times, is what is the single biggest burden to the business caused by learning and development? Sometimes we're our own worst enemies. And having those conversations, those real candid conversations, that can sometimes be a real game changer, because folks aren't expecting you to say something like that. It's not disparaging about the learning and development organizations. Being a realist, what barriers are we creating in healthcare? Required training, annual required training is a burden. There are, many regulatory requirements, and we've got to start using tools like adaptive learning to be able to, when you've got a seasoned clinical resource who's taken a page turner for the last 14 years, knows how to wash their hands, give them the tools through the technology, the adaptive learning, let them answer the questions, test out, and move on. You still meet the requirements of Joint Commission, OSHA, so forth and so on. You're not, you're really valuing the associate's time. That in and of itself will drive satisfaction. Oftentimes people will even say, wow, I managed to get through that in a lot less time than I thought. that is that reduction in time to train, increase in representative performance with zero negative impact to fidelity. In fact, oftentimes the fidelity is even better.
Yeah. I think a lot of people just get nervous about just the dialogue and the conversation, and we go back to that. You and I are both high on relation, right? we like to interact with people, and I think it's like that's where it all comes together, right? Is when we're working together for it. And I agree with you. And it's like, what are those types of things that we're doing that we do like mindlessly, but we know we could be doing more efficiently and effectively for the benefit of our learners as well as the organization. Think how much time could be saved using the approach like you talked about for clubbing out, because we still satisfy the requirement, So I think it's really being able to prioritize that. A couple of other things that I thought about there was really just some simple strategies for learning leaders. So if you can't get that traction, I think all the things that you said exactly spot on. But look around the organization and potentially find a burning platform, right? Find something with change impetus that you can get on board with and say, I can help you solve this. I have part of the solution for helping us get from here to there where we need to go as we begin to train the workforce in this change, this new system implementation, or this new, whatever it is that's coming down the pike. And I think that's really a powerful way to kind of get in there and get us the appreciation, I think, from leaders that you're there to help. And I also think too, this is, is being your own critic. So go out and talk to people, ask questions like what you talked about. It's like, you really need to ask. Part for me of doing the learning strategy is discovery. I love it because I get to talk to people all day long and find out really what's working for them. And what strikes me is that so many people in learning organizations don't ever take the time to talk to their own stakeholders to find out what's going on, or how satisfied are you, or what do you really think? And I think being forthcoming and just being really honest and putting out there what's working and what's not working, and that you're working on making this a different experience for them.
I believe where you can be that business partner, and I think that you hit on a really important component as you're building credibility with the business. Find someone who's a champion. Find someone who you can partner with and who believes in the possibility the glass is half full. And then, like I said before, deliver consistency always and in all ways.
So let's talk about gaining momentum, right, and sustainability. So we've got their attention now, right? They're opening the door for us to kind of show up differently with them, and we have this great opportunity. So, what do you think are some of the critical elements to really continue to build credibility, and not just that, but also make it sustainable? Like, so this isn't a once and done thing. Like, this is the way we are going forward.
Yeah, I'm self-professed high relationship, so I am very much an advocate of dispelling with the drama, the dreaded drama triangle, as they sometimes refer to it. And I think collaboration is the best way to do that. There's always going to be the peacemaker, and that's oftentimes, I think, what learning and development comes in and does. And if we can kind of change that vocabulary, change that experience, usually someone who might be a little bit of an aggressor, really there's an issue or a need that needs to be resolved. And whether or not it's learning and development, because let's face it, a lot of times the solution is not about learning and development, it's about compliance. So collaborating and establishing standards and guidelines, governance. There's nothing more valuable than recognizing that everybody needs bumper guards, and having really clear elevator statements. If, for example, leadership development is your area of focus strategically, get that elevator statement down to something simple like, we're about building leaders as credible sources of information, something that everyone can get behind. And then go deeper and keep going deeper. Ask, there's that ask why 5 times or what five times. Typically, you'll get down to what's causing people to lose sleep at night. And, I think governance, I think collaboration, being really good at your craft, again, kind of goes back to our earlier question. We are the, hopefully trusted advisors. And I know it takes time to build trust.
That's right. I know. I'm definitely on the governance bandwagon. I mean, I have seen time and time again that there's no better mechanism to create the right kind of check and balances, because usually on governance you'll have people from the different stakeholder audiences that you're supporting in the organization, and leadership, and hopefully someone from finances in there too, because they're the people that help you with budget, and the IT people. And I mean, so you have to be very strategic when you're creating a governance board, committee, or however you want to term it. But that is so important, and keeping that where everyone is accountable, because then we start moving to it's all my job to it's our job. So it's like,
Bingo.
I can't do this without you. And so, and if we're having issues, let's create a forum where we can talk about what's working, what's not working, and how do we do things differently. And I think, just having that transparency and that relationship and that forum that is consistently conducted to be able to do that. I know when I was working a lot with contact centers, I was definitely an integral part of the operations staff meetings. So I would, we would have people that would be there because, I'm responsible. So I'd be there for the VP of ops for all of the contact centers in their meetings. And I was part of that group. And also I would do quarterly results reviews where I would we always had a scorecard, and we tracked the results of all the things that we did. And we would provide a formal report out to them on a quarterly basis. And not to say you didn't meet your goal or your objective. Sometimes you don't know what the goal or objective could be. So why don't you together agree on kind of a line in the sand, and we'll come back and see how it turned out, right? And if we need to modify that goal, then we'll calibrate it and make it more audacious, or we'll scale it back because we were too aggressive. But I think it's really about getting back to conversations about the work that we're doing, so that you brought it up earlier in the conversation today, it's about collaboration, right? So we all own a piece of it. Let's work on this together and help me help you. So the learning organization from a sustainability standpoint, and really being able to make sure that we don't fall down, is putting the processes in place of how we manage our workflow. How are our teams structured to do the work? How do the requests come to us so that we can monitor them and track them and rationalize them? Again, is this really necessary, or are we building the same thing 10 times for different audiences? And it's like, so I know for myself with the people I work with, I'm a huge advocate of intake forms, so that we start saying, people have to kind of, you don't just get to ask us for training. You also have to kind of justify the rationale for it. How is it supporting our strategy organizationally? And also just having that visibility. This is where governance, and it isn't always at the highest level. You have your internal team governance structure, so there's different layers of that, right? To sort of filter through things. You got your staff that kind of looks at things and go, well, we're doing this over here. Well, we just did one of those over here, and we're like, why are we doing the same thing 10 times?
Yeah, couldn't agree more.
Great. Thank you both for sharing some of your valuable insights regarding learning strategy in healthcare. In our next episode, we'll hear from Dr. Dario Minaya, CEO from Minaya Learning Global Solutions, a training services company, on innovations in competency assessments that can be utilized in healthcare. Until next time.